Hi everyone, welcome back to Mobility Matters. If you have ever experienced the pain and stiffness of frozen shoulder, you know how much it can affect your daily life. In our first episode, we explained what frozen shoulder is and its three stages. Today we are uncovering the why behind this condition, its causes, and the factors that increase your risk. Stick around because understanding this can be the first step to preventing it. Now we'll talk about what causes frozen shoulder. We can categorize frozen shoulder into two types. Primary frozen shoulder that can happen without any obvious causes or injury. Researchers believe that it could be linked to an overactive immune response or certain hormonal imbalances. Secondary frozen shoulder can occur as a result of another condition or external factor, and it's much more common. Now let's talk about the common triggers that can lead to secondary frozen shoulder. After an injury or a fracture, people often tend to immobilize their arm during a recovery. This can lead to stiffness and eventually frozen shoulder. Did you know that up to 20% of people with diabetes develop frozen shoulder? High blood sugar levels may cause changes in connective tissue, leading to inflammation. Conditions like hypothyroidism and hyperthyroidism can alter metabolism and lead to tissue changes that affect the shoulder joint. Poor blood flow from heart conditions can also contribute to shoulder capsule changes. Whether it's due to wearing a sling, a sedentary lifestyle, or even prolonged bed rest, lack of movement is a significant trigger. Now your question would be, can frozen shoulder be prevented? So the good news is, yes, it can be prevented or managed if you act early. For example, if you had surgery or an injury, follow your rehab program diligently. If you have diabetes or thyroid issues, managing these conditions effectively can reduce your risk. And lastly, staying active and incorporating shoulder mobility exercises into your routine is key, especially if you lead a sedentary lifestyle. So that's it for today's episode. In the next video, we'll cover simple exercises to relieve frozen shoulder pain and improve your mobility. Don't forget to like this video, subscribe to Mobility Matters, and hit the bell icon to stay updated. See you soon.